Hello, my name is Dr. Michael Brad Bayless, founder of Bayless Healthcare. Today, we're going to take a journey and look at the therapeutic elements involving grief and loss. Grieving can be a highly personalized experience. It depends many times on your personality, your experiences, your faith, and how well you process loss and grief. But one thing is for sure, allow yourself time to heal and allow yourself time to process the information necessary for you to regain normal balance. Today we have Susie Waugh, who is a licensed clinical social worker and one of Bayless's senior therapists. Join me now as she takes us through a journey exploring grief and loss.
Hi. I'm looking forward to doing this presentation, which is on grief and loss. And it's something that I have had a big part in my life, in my education. So that's actually a picture of balloons flying up to the sky. I worked with the Children's Cancer Center with Camp Rainbow, and Camp Rainbow is a camp for children who have cancer, from young of, probably the youngest there would be 5, the oldest 21, 22, depending on disabilities and things, also falls with the law. So know that kids don't complete at 18 if they're under special ed, you carry them through 21. So different things like that were a piece to the puzzle, and I was able to work with the brothers and the sisters. And often what happens is we forget that there's a lot of dynamics that go with chronic illness, death and loss, with other people in the family. And so that's one of the other critical pieces. So we would have a tribute, we'd call it an anniversary day, and we would have a tribute where we would send messages up to the sky. So this is kind of honoring that memory. So what you're supposed to do here, which I'm not sure you'll be able to read, is read the 2 definitions of grief. Can you actually see this or not? So what I'd like you to do, if you could, is read that and tell me key phrases or words that fit with that. So I'd like you to just read those and tell me what fits for you when we talk about the word grief. Anybody? Key words? Just shout them out. Okay, great. Normal. Why would you pick that word? What does it mean to you?
Because everybody probably goes through it.
Exactly. Right on target. What else is up there?
Grief is a much broader thing.
Excellent. So what we know is that grief is a part of loss. Grief doesn't equal only death. And that's one of the things we'll walk through today. So you're absolutely right. We also notice that it affects the whole body, the mind, physically, emotionally. It's affecting us, creates anxiety. And that doesn't always mean that we're moving into a diagnosis that's going to be affecting our daily living, depending on what grief looks like, how long it is, and what's happening. So thanks for doing that. So just a definition of grief and loss. Hopefully you can see this. But basically, this is the beginning of human development. And when we look at the development of the person, we want to start at the beginning, obviously. And so birth takes place between fertilization and 40 weeks following, at that point which the baby is fully formed and ready to exit the world. Entering the world is this precious little thing who actually is in the NICU. Anybody know NICU? What is that? Neonatal intensive care. And unfortunately, this was my child. Not my child on the screen, but my child in NICU. So my husband and I were so excited about having our first baby. And we went to this class, and they talked about how wonderful it was going to be and what was going to happen and how you would never be the same as a couple. You would now become a family. And that the baby would be going home with you. So when they turned to me and said, they're discharging me but not my baby, there was an incredible feeling of loss. What do you mean? They said I could take my baby with me. What do you mean he's going to stay in the NICU? I'm moving in, right? So people go through this often, depending on their babies. And at one point, it's a blessing that 85 to 90% of children survive the NICU. And at another level, children are being saved at the gestational age smaller and smaller and smaller. So 24 weeks compared to 40 weeks. Think about development, okay? So my child was born at 33 weeks, and he didn't know how to suck, okay? What do we use sucking for? Eating. Is that one of the most important things that the baby's got to do for nutrition, for value, for growth? So we had to work with a specialist on learning to suck. Sucking comes in 6 weeks later. So what's that, 37 weeks, I think it is, 38 weeks. So working with my child on that. Some of the stresses that parents go through. They had fed my child not soy, but a milk product. And there were some complications, and he developed what's called necrotizing enterocolitis. And because of that, he couldn't process the foods. So I had two neonatologist surgeons in front of the incubator fighting over to do surgery or not do surgery. So a lot of stresses, a lot of emotion, and a lot of grief. And in that particular situation, I played two roles because I was finishing my master's degree as an intern working with the social worker in NICU. So I knew way too much in this role, and I was a parent in another role. So I tell you some of these stories so that when you're working with our families, you can have some idea of what they're walking, what their journey is as they continue to go through. So then we know we move to the next phase, which is birth and infancy. And he's a cute character up there with really big eyes. And we know the first stage of life cycle, human babies are born approximately at 9 months. And they need to be fed and cared for. And they're not independent, right? So they depend on somebody to take care of their needs. Touch is very important. Sight is very important. Talking, cooing, singing, etc. Moving into childhood, which moves us into approximately, sometimes we call the toddler ages through the first 2 years. It depends on who your researcher is as to what is said, but 1 to 10 years of age, where they continue to become a little bit more independent through their play, through their learning. They start usually preschool between 3 and 5, the majority of kids, and then move into public school, where they learn about peer relations, where they learn about sitting still. So think about a child who never went to preschool. They're 5 years old. They've been running, playing, active. They can do whatever they want throughout the day. And all of a sudden, boom. Indian style, or whatever they say, cross legs on the floor, sit down with us and listen to the story. Right? And a lot of those kids aren't able to do it. Doesn't always mean they just jump right into attention deficit hyperactivity disorder. Sometimes it's familiarity, environment, getting used to it. So you see growth and development throughout all these stages. Then we hit adolescence, typically between 12 and 18. And all the different things that come with wanting to be independent, but still wanting to be dependent. And how does that look with all those factors, including the pieces of development with physical, social, emotional. They say, or one of the doctors had told me at one point, that a baby from 0 to 2 goes through as much change in development. So think about that rolling over, think about crawling, think about walking, think about eating, think about talking, etc. As a 6th through 7th grader will in development with social, physical, etc. All those different components of development. Only he said they're not as cute. Sometimes I think they're as cute. But the reality is they're going through just as much with all those hormonal changes and that newness of trying to declare, I'm independent, I'm going to take on the world, while they still want to be with mom or dad or siblings or whatever that looks like. And then, of course, we go to adulthood, which is considered the longest stage. I think a lot of times in development, people decide that adulthood equals, after you get married and after you have babies, that's kind of it, and you're just continuing down the cycle. But there's a whole lot more to development if you look at Erickson, you look at different theorists on there. So there's a lot of different components between jobs and relationships, and then even if you're in, let's say, a long-term marriage of 15, 20 years, who are you? So a lot of redefining yourself. as you continue through adulthood. And then we have later adulthood and what that looks like, typically 60, 65 years of age on, and what's going to happen and what's going to change physically, emotionally, sexually, etc., in your relationships, who's living and who's dying and what's happening. And it's also full circle if you look at development. When I go to some of the assisted living facilities, they'll talk about how Jerry went to Liz's room last night instead of going to Beth's room last night, and what the relationship is. And it's kind of interesting to watch the dynamics and what they decide to focus on throughout their day. So it's almost like that life cycle continues and it's going backwards then as we regress in different parts of our body and our mind. And we start to deteriorate as the life cycle begins to end. Types of loss. So feelings of loss are very personal. And just because you might not feel this doesn't mean I'm not going to feel it. And development is a huge piece to all those things. So in working with kids or adults, you want to think about that. So if we have an adult who's 25 years of age, but maybe he's had a TBI, a traumatic brain injury, and maybe he is functioning at a 9th grade level, we want to be cognizant of how we're working with this this adult, that they're not a child, but that cognitively they've regressed to a 9th grade level. So how are we going to teach, guide, and support therapeutically? So besides death, let's think about how many losses we can come up with in our world. So just shout them out and we'll count them out.
Job loss.
Child loss?
Job loss.
Job loss, absolutely. Job loss, there's one. What else?
Losing a house.
House, 2. Another one? No?
Spouse. Spouse, like divorce.
Spouse or divorce. Okay, 3. What else?
Physical health.
Physical health, absolutely.
CPS involvement.
Excellent, CPS involvement. Why would that be a loss?
Losing a certain lifestyle, school, friends.
Excellent, right. What else? Get your juices flowing.
Loss of friends.
Loss of friends, excellent. And so in elementary school, how does that tie in? What do we hear about kids saying their loss of friends because of what? They moved away. What just happened in New York? Right? Possible moves, right? With Katrina. I also helped to run a program called McKinney-Vento, which is the homeless law. Homelessness, huge piece for our kids. And it doesn't matter so much the areas anymore. Sometimes we decide, oh, it's only this area or only this culture. It's not working like that. So I have several parents who are 6-figure income earners that, boom, have lost their job. And all of a sudden, they don't even know how to deal with that. Compared to maybe other families who have been in lower socioeconomics before, they've lived that life and they sort of know that survival. So they're great teachers because of that compared to the mom or the dad who's got a multi-level income and all of a sudden they're in a Motel 6 or a fire. So different kinds of things like that. So somebody named this right off the bat, which is serious and chronic illnesses. Cardiovascular, heart, diabetes, hypertension, kidney disease, liver disease, cancer, COPD. How many of you have seen that in the all-text system when you go and look at the chart? COPD, what does it stand for? Close. Correct. Okay, and so that's all different components of what part of the body, what part's being affected. Excuse me? The lungs, absolutely. And breathing is a pretty critical piece, isn't it? Epilepsy, osteoporosis, different components of chronic illness that create loss. Loss of your physical abilities, vision, hearing, ambulatory. What does that mean, ambulatory? Whether you can walk, whether you can move your limbs, are you wheelchair bound? Are you able to do that? And even if we look at the word ambulatory, and we think of somebody who maybe is suffering in some way with that, now we're also talking about other components such as PT. What's that? Physical therapy, excellent. OT, occupational therapy, speech, etc. So there's a lot of components to each area. Unfortunately, at 16, my niece was in a near-death accident. Not only did she break her neck, but her arm was severed off. She made a decision she didn't make a decision, I'm sorry. Eventually, they made a decision not to do a prosthesis, and so she doesn't have her arm from here down. And because of that, there's a lot of people that are sort of shocked or surprised, and so the look she gets and how she responds to that, because of her injury, she also has, traumatic brain injury. So she's got a lot of different components. She still lives and has that one small little thing, or is it a small little thing? So when we talk about this is physical abilities. Death. Somebody mentioned spouse, infant, child, adolescent, loss of a friend, a partner, a classmate. How many kids have somebody in their class that has died? Even teachers, It's who makes up their world and what does life look like for them. Coworkers or a pet. A pet is a huge loss to people. So being aware of those different things, even if they don't fit in your life, not standing in judgment. Loss of a relationship, a friendship, a marriage, a love. And sometimes people will just say, oh, just get over it. You'll move on. You'll meet somebody better, right? But the reality is that this person is important in my life. So allow me to grieve through that. Loss of change, having to leave your home, a job, unemployment. Okay, reality check here. We have so many people who are unemployed at this point. And all the stresses that go in with that affects their everyday living, which comes all the way down to homelessness as well, loss of insurance, different things like that. Loss of a cherished dream. I was really close to somebody in college, and his whole life he wanted to be a fighter pilot in the Air Force. It was his dream he lived. He was ROTC, and as a senior he graduated and he entered the Air Force. And he went all the way through, and at this particular time, they didn't have any of the special eye surgeries. And so when it came to taking the tests of what he needed to be able to perform with perfect vision, he was unable to do it. And so he wound up no longer being in that system. Devastation. Crashed his world. Eventually found a whole different route, but still a loss. Loss of safety as well. For some people, it could be something like a break-in. And what did that look like? What did that mean? Even if they're not hurt, that environment was their own. And so safety has been jeopardized there. Two theorists that are have been very popular a long time is Kubler-Ross. How many have heard of Kubler-Ross? Right? And so her 5 stages of grief. And then also Warden, who has a whole theory as well on tasks of mourning. So when we go into Kubler-Ross, the very first stage that she'll talk about is denial. What does that mean?
Not wanting to face what happened.
Not wanting to face what happened. So you're cooking dinner, and you have your kids at home, and the TV's on, and you get a phone call. And on the phone is your family member who says, "Are you okay? I need to give you some bad news. Your niece has just been in a car accident, and she's not expected to live. Come to the hospital now." What do you say? I have to finish dinner. What? The kids need this. Was she driving? Is she okay? What do you mean? Can you say that again? Right? Trying to digest, trying to understand denial. Anger is another stage she talks about. So when we think about anger, what are some things you have thoughts about with that? What happens? What do people do or say? Blame. Pass the blame to somebody. Must have been the other driver. Couldn't have been her. Not possible. Right? What else? Say it real loud.
Becoming mad at themselves.
Absolutely. Internalizing it. I wonder if there was something else I could do, right? Remain detached, non-judgmental, manifested side of them, become explosive, right? And this one's a critical piece. Dear God, just let them come out of the coma and I'll be okay. I'll do whatever you say. I'll go to church. I'll go to temple. I'll follow all the rules. I'll never swear again. I'll put all the quarters in the jar like my mom told me to. Whatever, right? Bargaining is a critical piece. Death and loss and grief in general. And depression. I'm so sad. Why bother with anything? I'm going to die soon too, so what do I care? What's the point? I miss my loved ones so much. Why go on? During the fourth stage, the dying person begins to understand the certainty of death. It really becomes real. Because of this, the individual may become silent, refuse visitors, and spend much time crying and grieving. And this can be for both the person who is in the process of surviving and the person who is dying, because both have journeys to walk. So how do we as practitioners help with that? And another stage of acceptance. So it's going to be okay. I can't fight it anymore. I know I'm dying, and now it's time for me to start my process of saying goodbye and ending my life. And who will be in my life, and what will happen as I accept my journey into death. Okay. What we know is that this process is not a straight line. So it's not, okay, today I'm going to be in anger, and then I'll go to depression. It's not like that at all. It's very jagged edge. And so one day you might say you're completely out of denial, and another day I picked up the phone to call my dad who died last year. But I want him here. So if I pick up my phone and I try to call him, I don't know the number to heaven, but how do I get him? So whether I'm 49 or whether I'm 12, I'm still dealing with those emotions. Our jobs as therapists is to developmentally figure out how to support them through that. So grief is like a sharp pain and a dull ache combined in a continuous heartache. How many of you have ever had anybody in your life that's been real special to you die? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. So 10 people have lived through that. And can probably relate to some of this as well. What we know is that when you ask that in a classroom of 24 to 30 kids, even in second or third grade, you're going to get a lot of responses, whether it be death of a pet, death of a grandparent, death of a friend, death of a teacher. So being aware that people are living through death. It's a life sentence of a broken heart. Tears shed for another person are not a sign of weakness. They're a sign of a pure heart. But often we say things such as, big boys don't cry. Or, stop being a baby. You're such a girl. Right? Reality. This is fresh pain. And this is not something that's a straight arrow. It's jagged edge. So it could be 2 years down the road, and you may have something that happens. You're driving to work. You're supposed to be professional. You have a client coming and you hear a song. Boom. And the grief takes over. And then you feel bad. Oh, I shouldn't be crying and I shouldn't have tears and I have to go in. Reality, right? Grief lives inside of us. And hopefully so does that person through our mind and our heart. So this was one of Kubler-Ross's book on death and dying. So I was just showing you the cover if you were interested in that. We're going to give you some resources as well, so don't worry about that. So this is her book in 1969. And this is Warden's 4 Tasks of Grief. He talks about the reality of the loss. He talks about denial, minimization, distraction, denial through fantasy, different things such as that. And it's his grief counseling and grief therapy for mental health practitioners. So I don't know if you can read this, but there's 2 different components on here. One is end of life, discussions on dying and dignity. Critical word. The second part is, why is death a taboo subject? And what do we as therapists do about it? So I'm going to open it to the floor, and I'm going to ask you to talk about these 2 slides and tell me what your thoughts are. And if you could talk loud, please.
Death being a taboo subject, my husband and I talk about that a lot. He's unfortunately had a lot of experience with death in his life, and he's constantly talking about how, when he was a child and there was a lot of death, he had to go to a lot of therapy, and he said the counselors were always really reluctant to talk about what it was. So it's really important as a therapist dealing with grief and loss to address the issues that you personally have with it, to even begin to address your clients.
Great.
And he was always so mad at these counselors because he, even as a child, said, "I'm good with this. We can talk about death. It's okay," and they would just avoid it.
Wow.
So I think being
Thank you. Somebody else?
From a client perspective, understanding their spiritual and religious beliefs, especially with the Native American populations, and their views about death, and sometimes bringing up death and discussing grief and loss is kind of bringing somebody out of the dead, out of their grave. And so while it's important to discuss it, it's also important to be culturally sensitive too.
Great point. So I'm working at Phoenix Children's Hospital. I'm going to take on the world and make change and help everybody possible. And a 4-year-old boy, Native American, dies. And they get special permission in the hospital to bring the baby, the boy, to the room and allow the family to grieve. What an incredible process to be able to say goodbye that so many of us don't get. So I got to carry the boy. And so I had all these different things going all the way back to U of A with Dr. Wren and thinking all these different things about how honored I am to be able to have a tiny little piece to this puzzle for this boy and giving him to his family. And so carried that baby there, and the family got to spend some time before they had to leave, which is another piece. Tell me what you think about the word dignity. What does that look like? Yes?
I think it's mindful as therapists to be aware when folks are within a medical institution that their dignity could be compromised and robbed, as medical professionals are trying to continue a life and overlook the individual's real desire or preserving them as a person.
Absolutely.
Sick object.
Great point. How many of you have seen that in a facility before? How many of you knock on the door before entering? Excellent. Critical piece. So much of their world is taken away when they wind up living at different facilities. So maybe they came from this house with a spouse and kids, and maybe they wound up having to, oh, this is Bayless. How funny. Maybe they wound up having to go to this facility, and now they're sharing a room with somebody they don't know. They have to eat the food that they don't like. Culturally sensitive, it doesn't fit their world. They don't have enough room to bring in their stuff, so now they're called a hoarder and a collector, and they're talking about maybe throwing them out. They get a 30-day notice, right? So different components like that. So death is considered a taboo subject, although more and more both sex and death have been taboo subjects in our culture, in our style, in our talk, our norms. And now more and more we're starting to become more comfortable talking about these things, especially showing it on TV, right? So we want to open those topics up. And I think a lot of times people think, well, if you don't talk about it, then maybe it won't happen, or you'll just get over it. It's not real. It comes back and it gets us. So 80% of people die in a hospital or a charitable home versus dying with family members or at home. Dying in their own home is no longer a normal thing that happens. It's important for everybody to be aware that everybody is going to die. Feelings and fears and hopes, they all surround this. Everyone grieves. Grieving is personal and individual. How you grieve depends on many factors, including your coping style, your life experience, your faith, the nature of the loss. For some people, there's a whole system to the death. There's certain ways you dress. There's certain things you do. Sometimes you don't eat. Sometimes you do eat. Sometimes you go to certain buildings. Sometimes you bring people into your house. A lot of different components. So I loved what you said about trying to become culturally sensitive to what that means. And there's nothing wrong with saying, I just don't feel very knowledgeable. Could you help me with this? There's nothing wrong with that. So common symptoms of grief, we talked a little bit about denial, but obviously we have shock and disbelief. You may have a feeling of numbness, that this couldn't possibly happen. They didn't really just say that, did they? That couldn't be. I just saw them last night. We were at Olive Garden together eating. How could they possibly be dead? Right? So denying the truth of that loved one no longer being with us. Sadness, profound sadness. And you may have feelings of emptiness and not knowing what to do, having deep sense of loneliness. talked a little bit about anger. Anger at the hospital. Anger at the doctors. Anger at them giving the wrong medication. Anger at God. How could God possibly take this person from me? I'm not ready. Lots of different feelings. Feelings of abandonment, injustice. And then guilt. Maybe if I would have done some things differently, I left the hospital too early. If I had been there 10 minutes later, I could have said goodbye as they died. I was holding his hand 10 minutes before. How could that be? And then sometimes it moves into physical symptoms, headaches, stomach aches, school phobia, not wanting to go to school because I have to stay home and protect my mom now or my dad now, because what will happen if they disappear too? And obviously fear and anxiety, a feeling of insecurity that, you know what, if this could happen to them, it could happen to me, right? And a whole awareness with what does that look like. So there are a lot of myths out there. The pain will go away faster if you ignore it. What do you think of that? What would you say to that? How would you guide somebody with that?
Yeah, I have a client who, for different reasons, had to avoid certain things, and now she's probably 10 times harder now after, having the time pass, and it's probably close to home.
And so they often don't realize that they're going to be stuck. So I wound up working with a kiddo 2 weeks ago, I guess about 3 weeks ago, and his mom had mental illness. And she was pretty severe, and she was playing with her meds and doing a lot of different things. And when he left the house to go to school, she took her whole bottle of lithium. And that put her right into a coma, and they air evac her, and she was in ICU, and then she had a massive stroke and was on life support. And then this boy and his father, who he hadn't had contact with the father because he fell under my program I told you about, McKinney-Vento, homeless law, all of a sudden he's got the transition to his father, had to make the decision together. The sister, long distance, flew in so the three of them could be together to make a decision to take her off life support. They said she would die right away, but obviously doctors are human as well. She didn't die right away. She hung on for about 4 or 5 days and then died. So I met with him after she took the lithium. That's when I met him. And then I met with him again right before holiday break when we knew she was on life support. And then I met with him again after we returned from fall break and she had died. And he sat across from me and he said, I can't do this. I can't talk about this. I don't want to talk about it. I'm just better not doing it. And so I said to him, well, what are you doing? And he's very musically oriented, and so he's writing songs and he's doing things like that. And so lots of praise with that, lots of talent and skill and ability. But I said to him, you certainly don't have to share right now. This is fresh. This has just happened. But I want to let you know that at some point, finding a trusted adult or trusted someone could be very helpful and healing to you. He can't hear much right now, can he? What stage is he in? Maybe. Still shock, disbelief, right? Absolutely. But it's our jobs to try to move him forward as much as we can, or support the dad, or give them the phone number to New Song Center. How many of you know about New Song Center? Super. So what's New Song Center? Who knows? Laura, you know?
It's a support group for children that have lost.
Absolutely. As young as 3, as old as 21, free service. Kids go into group typically 8 to 12 weeks. Parents or guardians are also a piece of the puzzle. They're in a different group, and then they all come together. Nice resource for families. Right now, that resource is probably not great for them. They're probably not ready. It's okay. It's not right or wrong. It just is. Okay? So, another myth. It's important to be strong in the face of loss. What do we think about that? Good point.
Strong can be embracing the pain and tragedy of it, as opposed to being strong, misdefining it as denial. Don't let anybody know how you feel. Don't let him know. We flip-flop on that. What true strength is being able to have the courage to face it. tend to categorize strong as the opposite.
Right.
Being strong for someone else, being strong for other people, those kinds of things.
Absolutely. And so even if you think about your own family dynamics and you think about somebody, God forbid, dying in your life, and let's say you're the one that typically kind of is the leader or the holder together, the glue, or whatever you want to say. And so your commitment is in caring for your family, in making sure everybody's okay. But, oh my gosh, how you miss your father. But, oh no, you can't acknowledge that yet, because did we get the funeral? Did we get the casket? Did we do the memorial? Is my mother okay? Because she's the spouse. So if I'm the kid, you know, I'm supposed to protect, guide, and support. Supposed to. So you put your grief off, and you wait, and you wait, and you protect, and you guide, and you support, and boom. So at some point, even if we're skilled or gifted or we know this material, we crash too. So that was me. The call of my father on New Year's Eve, that instead I was going to see him tomorrow, he had been transferred over to County Hospital. And so rushing over there and supporting him and saying, we're all here for you, and you can do this and everything. And then watching the process of life support, and then having him come off life support, and watching my family crumble. And I took one day to crumble. And then I decided, oh no, that's not my role. I've got to be careful. I've got to stay strong. So I did my own personal time. But just some personal information, I'm Jewish, and so in our faith, at 11 months, we put up the headstone. And I crashed, because all of a sudden, it couldn't be more real for me. And so my second year, from the death to the first year of the anniversary to that second year, has been much harder for me emotionally. So just to acknowledge we're all human too, and that at some point, even if we know bargaining, depression, anger, sadness, it doesn't mean we get to avoid it. It's still a part of our world. So symptoms of complicated grief. When do we start getting concerned? Intense longing and yearning for the deceased for years after years, intrusive thoughts or images, denial of the death or disbelief. So I had worked with somebody whose husband had died, and at 4 years she was no longer allowing anybody to come into the house. And we didn't know what was happening in there. And she was losing a lot of weight, and she wouldn't stay on her medications. And we were concerned about her survival. We knew there was a dog in the house. We didn't know if she was getting groceries. We didn't know much about what was going on. And the family was trying to get it set up for guardianship, so that they could take over and make it stand so she could get treated. They could go in the house, etc. And she attempted suicide. She took a bottle of pills. Right before she went under, she called her son and left the door open. And that's when everything changed. And the family got guardianship. The family placed her into a facility. So this 4 years later. And she stayed on her medication, and she came back into the world, and she started to eat, and she started to live again. Not so much without her husband, but she was living with him in the house. So what does that look like, when grief is so complicated that it overtakes our life and we're stuck? So I don't know if you can read this, but we're talking about suicide, preoccupation with that, the hopelessness, the worthlessness, what's happening to the body, etc. So we've talked a little bit about that. Yeah, sure.
What's the difference between normal grief, I guess that's appropriate, versus sometimes complicated? Because, like you said, people can have varying ways in which they might express it. So how do you know when you're concerned and when you're...
Great. Anybody have ideas on that? Okay, so initially what we know is that we're going to go through those stages of denial, sadness, depression, and typically you're surrounded by friends or you're surrounded by family. And really how I see it is it's the job of those people to make sure that person is okay. In a lot of the cultures, you bring a lot of food over so that you don't have to cook. In some, you don't get dressed for a week, you don't look in the mirrors, you just kind of exist. In some, there's daily prayer, a certain dress, going to the gravesite, going through the funeral. So what you bring up is a really good question in what does that mean? Some of the research shares that antidepressants can be helpful for level of depression, depending on where they're at. Are they crying nonstop and not able to function at all? Are they not getting out of the bed? Are they not eating? Are they not sleeping? And the truth of the matter is some of those things are part of grief. So that's why you want to watch and see and decide, are they moving into danger to self, danger to others? Are they moving into a place of not being able to function? Because then that's not okay. But the reality is you walking, if it's somebody that's a friend of yours or a family, you walking that person to the funeral is going to be filled with depression, right? And looking at the grave, and for some people, watching that casket lower into the ground. And for other people, putting dirt on that is another piece to that puzzle. Those are traumatic events, but very necessary in grief and loss. So I think time, appearance, your DSM-4 moving into 5, looking at some of that criteria helps, and other suggestions.
Part of it is looking at the kind of spiral of dysfunctionality. What happens is, if it becomes complicated, the dysfunctionality spirals outward to be all-encompassing in your life. Okay? That you're going to be, like Susie's saying, you're going to be kind of placed in a stasis for a little bit, in whatever way that shows up culturally and visually. You're not going to be functioning at your peak level. Then you start recovering spirals of functionality. If your spirals of functionality, or actually loss of functionality, actually continues to expand, then you're moving to something that's more complicated. So you have to watch whether functionality is recovering or dysfunctionality is expanding.
It's a great way to say it. Absolutely.
I have a question for you, Susie.
Go ahead.
In your opinion, how do you feel about the controversial issue kind of right now between, DSM-3 went from a year before major depressive disorder to the DSM-4 being 3 months, and now the DSM-5 is saying 3 weeks is the proper amount of time.
Well, I hadn't heard about the 5.
There's a big controversy right now with the board.
And I could understand why that controversy is existing when you study about grief and loss.
I just can't imagine the loss of a child saying, okay, well, you should be back to normal within 3 weeks. Otherwise, I'm going to diagnose you with major depressive disorder.
Absolutely.
So I just was wondering if you've heard about that or feel.
I hadn't heard about the DSM-5. I think that it's something that could be a real problem because, once again, who decides how long grief is? And the truth is, I find that people become really educated when they're slammed into that situation. When it's somebody more than a friend, or when it's somebody really, really close. I mean, there couldn't be anybody closer to me, in my life than my father, right? My father was my everything. And so I have dealt with a lot of death and loss. I mean, worked at the Children's Cancer Center, did a lot of different things in Phoenix Children's, have had friends die. Not that those haven't been significant in my world, but this was my father, my goodness. And so there's differences. And so I think that it makes sense why there would be a conflict. I don't know. How do other people feel about that? Think it's going to be a problem?
I just find it interesting that the board that's deciding this, I think there's 75 to 80% of them are being treated by the pharmacist.
Oh, really? Okay.
No editorial
Bias?
there, right?
So I know there's a lot coming out with the DSM-5. I'm not overly educated on it yet, so I can't really help with that piece. But I know that things have changed. 1 minute we're saying this is going to be in it, then we're saying it's gone, then it comes back. So I know there's a lot of movement with what's up and coming in May 2013 if they stay on target.
I think what you're saying about it being a process is really the key, and any efforts to put numbers onto that is us trying to become a false hard science. Because like you were saying, it's all about the value you attach to the loss. And so nobody can put a quantitative, well, this loss is worth 10, this one's worth 15, so you should be back in 3 weeks. Most clinicians are going to have a big problem with that. So.
Right. Great questions, though. Absolutely. So guidelines to share with adult caregivers when you're talking to children about death. So first, I want you to go back to the beginning, which is human development, and think about the baby. Think about all those different stages and ages that we walk through. And then we want to inform the child using simple information. And as to how detailed it is, depends. For some people in regards to murder and violence, I'm not really sure those graphic things need to be shared. There are other people that feel very strongly about that. For some people, they keep secrets forever and they don't say that the person has died. So those are different critical pieces that we need to think about when we share with children. So sudden death, an example. Dad's heart stopped beating today and he died. An accident. Mary was in a car accident. Her body was very badly hurt. It couldn't be fixed. She died. Old age. Grandma was very, very old. Her body stopped working, and she died. Terminal illness. Because the disease couldn't be stopped, your dad got very, very sick, and his body stopped working. Your dad has died. What's the word you heard me say throughout that whole thing? Pam?
Died. Permanent. It's not just, oh, he went away, we lost him, because for a kid that's lost, what does that mean? Was he coming back?
Absolutely. Great. And that's really a critical piece, and I think sometimes we like to use other words, and there will be a slide on it, but they passed away, he's sleeping in heaven, different things like that, which we'll get to as well.
Just real quick, too.
Sure.
Your thoughts about the term sleeping, because I worked a case once, and they told there was a 5-year-old kid, and they said, well, your dad went to sleep. She couldn't sleep for the next 6 months.
Absolutely.
Because she was afraid if she fell asleep, she wouldn't wake up like her dad.
Absolutely.
Now, it took the therapist a few months to figure that out. But that direct approach is so reassuring, and it speaks to the fact that we have to be real comfortable with talking about this topic and not using all those metaphors that gives the person, particularly as bargaining or denial, a sense of hope. Maybe you'll come back, and maybe you'll wake up, and all those kinds of things.
Absolutely. And so you want to think about, what does sleeping mean? Sleeping, everybody sleeps. So I'm going to stay up for the next 10 weeks, right? It's not going to work. So those are really critical pieces. So I told you a little bit about, I worked with the Children's Cancer Center for a while. I worked with a sibling group. And I developed a program for brothers and sisters of children who had disabilities and chronic illnesses as a support. And we were in group one day, and a 9-year-old boy finally felt comfortable enough in group that he started talking about what had happened with him. So he was outside, he was playing soccer, and he was with all his friends, and he's 9 years old, and they're having a great old time, and it's time for dinner. So mom steps to go outside to go and get him and say, time for dinner. And she's pregnant. She's like 9 months pregnant. And he kicks the ball to his friend, and it hits her right in the stomach. Oof. She goes down like this. Oh, that hurt. Kind of recovers, goes back inside. They eat dinner, etc. A couple weeks later, they have the baby. And this kid just plummets after the baby. So did he plummet because there's a new baby, because he's growing, because he's changing? What's actually happening? And it took a long, long time for him to finally say he thought that he had injured his mom. He had injured the baby. And so for so long, he has carried this guilt because the child wound up having a handicapping condition. So in the end, he caused it. And he never told anybody. And finally, at 9 years of age, I don't know if he was 6, 7, I don't really remember how old he was. But think about what that means when you carry all that and that you're at fault for what happened. And not at all. No fault to the mother. How could she possibly know? No fault to the child. Just a lot of stress and tension when we talk about those things. So reassuring the child that they are loved, acknowledging that you have a relationship. Touch is a critical piece at this point. Letting them sit on your lap, hugging them, putting your arms around them. Very important. Oftentimes, children are afraid that the other caregiver will die. We talked about that. So if I don't go to school anymore and I stay at home, I'll protect them, right? That's another piece. Most people do live for a long time. So being direct with the child in a soft, simple way. I am not planning on going anywhere. I am working out. I'm eating healthy. We're all concentrating on that. And so we're all going to do our best we can in surviving, right? So it's important that the child be reassured. And sometimes we move into a place where parents can be more punitive or punishing if a child's crying a lot or if a child starts acting out. So it's real important to help those guardians or parents or whoever they are realize that this isn't behavioral manipulation, different things. This is a child grieving and not knowing what to do with these feelings. So how do we then help them with anger? Okay, what do we do with that? It's important that children are reassured and that they know that it's not their fault, like we talked about. So recently there was an uncle that called me. He is not the guardian of his nephew, but his nephew's in 7th grade, and his father died when he was 3. And in April, his mom was in a horrific car accident, and due to extensive injuries, she died. And the uncle was supposed to have gone on the trip that she went on. He was supposed to have picked up the daughter at college, but he got the flu. And so he said to her, just wait. Don't go, and I'll take care of it in a couple days. We'll call her. We'll make sure she's safe at college. Everything will be fine. I'll drive. I'll get her. It's not a problem. The mom was too anxious about getting her daughter and went, and on the way back, she was in a horrific car accident. A pillar fell on her, and she lived for 4 months, actually, as they watched this deterioration of her body and head trauma and just end of life. And so now he has this incredible feeling. He didn't really want to talk much about it because it was really about his nephew. But I pushed a little bit, and I said, tell me about what your thoughts are. And he said, it should have been me. He's an adult. He's going through grief and loss. He's trying to caregive for a nephew who he doesn't even have legal rights for right now. And he's got the death of his sister in his head and his heart. He's blaming himself, right? So children's questions about death. Allow questions and answer them truthfully. Answer them as simple as possible. Children process information concerning traumatic death in small amounts. So you might give them a little piece, and they're off. And now they're going to play. And if we know much about children, we know play is a critical piece. In fact, in the hospitals, we have child life specialists that work on play through the treatment the child's going to go through, whether it be an operation or putting an IV, and the child uses the doll and they put an IV into the doll and they explain how the IV is going to give medicine or food or whatever it's going to provide. So play is a critical piece for these kids. It's not that they didn't hear you. It's very possible they heard you. Repetition is also another critical piece. Difficult on the adults, but necessary for the child. So talking to children about sadness. Children need to know why others in the family are sad, why they have tears, why they cry a lot. As adults, we model behavior. They're learning opportunities for the children, and it's okay. And the truth of the matter is sometimes it's more intense than other times. But making sure that there's a family friend or somebody in the family who's sort of responsible to step in case you're not okay, while still not losing all your control and power, which is another critical piece because you've had so much taken. You want to know that if you want your child sitting next to you on your lap, that's okay. If you want to share something, that's okay. But having that trusted adult available is also another important piece. So one of the things they say on here is a very, very sad thing happened today. I want to tell you. So we went through a couple different scripts. Mommy and Daddy are sad because Uncle Jim died today. Well, what's died? So what would we say to that? Let's say we have a child around 6. What's died? Nobody's brave enough to try? We'll have it on a slide, no worries. So what does the word dead mean? Providing children with basic information about the human body is a critical piece. What does the human body do? right? The brain's a critical piece. The breathing is a critical piece. The heart is a critical piece. So if you take your pulse and you put your fingers on your carotid artery to take your pulse, you're listening to what's happening in the internal part of the body. If you take your temperature in your ear or across your head or in your mouth, you're talking about what's happening with the body. So you introduce those things. The heart stopped beating. Feel your heart. Feel mommy's heart. Feel daddy's heart. Your uncle's heart stopped. No longer breathing. You see how there's air coming from my nose and my mouth? The breathing's happening. You can sort of feel it. You can't see it so much. You can sort of see it in the belly. You want to talk about the belly? Let's talk about how the belly goes up and down or the chest goes up and down in breathing. The brain is no longer thinking anymore. So making it really simple and concrete. This is a chair. I can touch it. I can feel it. I can sit in it. This is death. It's as abstract as you can get. What is death? Use language and ideas appropriate to the age of the child and communicating that death has occurred and a person's body can no longer be used. The body no longer can breathe, talk, walk, see, or hear. And let the child kind of talk a little bit about what that means too. So if the brain's not working, are they going to school? If the heart's not pumping, will they get up in the morning? Right, so those different things. Even though it's uncomfortable and it's not what we want to do, but it's necessary. Here's that slide. Use the word dead and died. Avoid using passed away. What does passed away mean? Well, we use it a lot. And typically as a therapist, you should know if the family uses it, I use it. But depending on where that family member is, I'll process with them as to if that's the best word to make sure that we're moving forward. Is that the best thing to use? Let's talk a little bit about what that means. They left us. Well, where'd they go? Don't they like us anymore? They went away? Well, I know. Let's get in the car and find them. Right? Let's go find them. They're gone. They've gone on. And, of course, sleeping, which is one of the most difficult ones that some people use sometimes. Well, they went with God. That's the other thing. If you just use a statement like they went with God, I don't want to go with God. Keep him away from me. So we're going to church to pray for God, but they took my dad. I don't want to go to God. No.
Or I want to go with God.
Or maybe I want to go with God. Or for this boy who's in 9th grade and he's watched his mom die by taking lithium pills, knowing he had mental illness, what does all that mean to him? Yeah, go ahead.
So I noticed in the case we talked about the case when we talked about his mom dying because of suicide, and you said it's okay, we don't have to talk about it right now.
This is the lithium, yes.
So what about in the case where the parent is in denial and doesn't want to talk about it? Are you trying to push and force the parent to talk about it even though they don't want to talk about it with their kids?
About the suicide?
Or about death in general?
Death in general. I would educate the parent. I would talk to them, and it also depends on where they are in their grief. Because if they're the primary person who's really being affected by this, maybe I really need to go to the other partner, or maybe I need to bring in an aunt or uncle, or maybe he or she isn't really safe living by themselves right now, and I need to make sure somebody's going to watch out for them. Because I can't go in the house, but I want to make sure they're safe. So let's say the dad is distraught. He's not in this scenario, but let's say he was, and I find out that there's an aunt. And so I might say, how comfortable are you if we call Aunt Laverne in to come over and be a part of this conversation? Well, why would you want to do that? I can take care of everything. Well, one of the things I'm noticing is this, and I'm concerned. And so I'm just wondering if we could support you some more with that. Because really, talking to your son about his mother just dying is going to be an important piece before you go to a funeral, a cremation, a memorial, whatever that is. Does that help? Okay. Okay, so we did that one. Here's a reality. So I'm going to do the light one more time. What's happening to her? What's going through her mind and her heart right now? Just shout out words. Angry? Pain. Sadness. Hurt. Excellent. From the youngest to oldest, grief and loss affects all. A child's concept of death from infancy to 2 years of age. Oh, the infant doesn't feel anything. There's no way they know. Not true. They have no concept of the death, but they feel there's emotions. We know that there's tears. We can see tension. We can feel it in the body. So what's actually happened? Well, maybe the baby's a little bit more cranky than usual. Or maybe there's lots of tears or vomiting. Maybe it's a 1-year-old, maybe a 2-year-old. Toilet habits have changed. So you trained this child 2 weeks ago, and all of a sudden he or she is regressing. Not unusual at all. Always wants to be with mom. Does not want to go to that preschool. I don't want to go to that preschool. And so holds on with all their might as the teacher tries to pull the child off, who's having pain of leaving their mom or dad or whatever that looks like. Let family and friends know what's going on. So if your child is in a preschool, or recommend that they let people know what's going on. And it doesn't have to be so detailed if they're not wanting to share, if it's a graphic death, if it's one that hit the media, whatever. But we do want to let the teachers or the aides or the principal or the therapist know what's going on. 3 to 5. They mostly live in the present tense, and they're really curious about life and death. So truthfully, life and death are intertwined. But we don't think that way. We say death is taboo, and life is living. But loss encompasses our world. So they see death as temporary. So I remember I was with a kiddo with the family, and the child was 4, and I said to her, so how are you doing? And she said, Daddy died. And I said, I know. How are you doing? He's a horse. He's running. He's a horse. Okay. I'm going to go play now. Great. It's all okay, right? Death is temporary. And also imaginative. So what's that magical thinking? What's happening? Where are they? Also, what are we doing with video games and TV? So at this age, think about when we used to watch The Roadrunner. What happens with The Roadrunner, right? Beep, beep, right? And is it Coyote that falls? Right. Coyote falls off, right? And he dies 72 times in every situation, and he always comes back to life. So just bring Daddy back. What's taking you so long, right? Lots of confusion. Video games, another critical thing. What are we doing? A lot of our adolescents are playing these games where they're shooting, they're killing. It's becoming more graphic with blood and limbs flying and a lot of graphic things with the movies. And then we get into a reality, right? Like Columbine. And if you watched on the news, and I'll tell you, one of my pet peeves was the schools keeping the TV on that whole day. As we watched the one boy try to climb out the window with his arms and legs hanging off. Or the planes in 9/11. They crash over and over and over again. And people weren't turning off their TVs, and they were reliving it. And people were moving into depression. So being aware of all those things and then thinking developmentally, where is this child and or adult? Reactions. They may show a little concern. They may regress into being more infant-like, crawling, baby talk. They may be afraid to separate. They may need to talk about the death over and over again. And that's where we talk a little bit about making sure you're not punishing. So you're not going in the potty anymore. You wet your pants. We don't want to do things like that. So we want to support and help the family with that. 6 to 9. They have a clear understanding of death. They also can comprehend that they could also die. They begin to fear death, and they may become more anxious. They may have ups and downs. They may be less willing to talk, and a lot of them actually start going through nightmares and night terrors. And so working on that compassionately and being responsive and non-judgmental, talking about those things is important, allowing the child to share their dream, talking about what does that mean. There's some different tools. There's one called a grounding exercise where you actually have the person get into their pajamas and go into their room and have the routine or whatever, and then they sit on the bed and they make sure their feet are on the ground for a grounding activity. And they can say, I'm going to have good dreams, I'm going to be okay, I can change the channel. Just different techniques in starting that at a conscious level. For adults, sometimes it's in dreams, and so you can have a notebook next to them with a pen or a paper, and if they wake from a dream, encourage them not to turn the light on because, boom, it takes them right out of that dream state, but they can write really messy across that if they're afraid of forgetting it or they want to put it out there. The other thing is before, with the grounding exercise, with older people, adolescents and adults, they can write all their feelings and their thoughts and their worries on paper and then give themselves permission to let it go until they wake, if that's what they want to do. So kind of giving them different tools. Some work, some don't, and it kind of depends on who they are and how they do with it. So we went through that. So 9 to 12, death is very personal. There is a curiosity about the body. So why did he need to give him an IV? What was the reason for giving him that IV? Well, that IV fed your uncle special medication to try to make him well, but it didn't help. His body just couldn't do it. Okay, so being clear with your biological. They begin to understand forever. They're not coming back. It's not a horse that will return and it'll be dad. They can differentiate between dead and alive, the beginning of life and death and integration of both. They often have difficulty with separation, anxiety, fear, a reluctance to leave. Sometimes you'll see the grades fall. They may be blaming other people. It was that doctor's fault. I know it was his fault. If he hadn't acted like that, then everything would have been all right. Right? So who are we going to blame and what are we going to do? Because sometimes that's the only way they can move on. We want to help them with that as well. Daydreaming. So a lot of times in schools, teachers will talk about they walk by the child and it seems like they're blank stare. They're just not there. And so maybe they've got a memory or a flashback or they've thought about their mom and what's going to happen and they're looking at 2:30, I can go be with her, whatever that looks like. Denial, guilt, hostility, distancing. They distance from their friends or they distance from the family. So always watching and making sure that they're okay is another critical piece. And they want to fix it. How do I fix it? Well, if we get everybody in the hospital and we go there and uncle's on life support, maybe we can talk him into not dying. Maybe we can tell him to come back. Maybe we can tell that doctor he was wrong. Right? So different things like that. Giving comfort, reassurance, permission to feel what you feel. It's the actions we're concerned about. Right? So bringing the BB gun to the hospital, not a good plan. Helping them realize that there's still boundaries. Truthfully, there's still life. And what does that mean? Being honest and listening. The teen years, they're adults processing. They're moving more into an adult processing. They can think more abstractly, so you can have those conversations with them and talk about what they're thinking and feeling. So dad is the one that used to do all the banking, the checkbook, the online. He knew the computer. He took care of the yard. How will you do it, Mom? Right? What does that look like? Understanding the implications of death. You assume the adult role. That's it. I'm 15. I'm the man of the house. I'm taking over. Right? That's a lot of pressure. And a lot of desire, because a lot of times those kids want to protect. Right? And we want to support them in that, but we want to balance it too, because if they give up their childhood, we're not any better, are we? And school is still imperative for them, and learning and growing and all the changes they're going to go through. So encouraging communication. Oftentimes we have shut down. And so I was working with this one mom whose husband had died of a heart attack. And the girl I was actually working was, she was 11 years of age. Her brother was 15 when the death happened. And he wouldn't do anything. He wouldn't sit with us. He wouldn't do anything. So I stopped talking completely about that and just started to get into his world and found out what he was interested in and found out that really he needed to be with a male more than a female. And so they were very integrated in their church. And so we worked with the pastor, and we got him involved. And at 18, he went and he had his dad's name with a special symbol tattooed on the side of his body. And that's when he moved on. So it was really interesting as to what happened with him. He was typically kind. It wasn't that he wasn't. He couldn't go there with me. And so that was okay. So we have to be okay with those things and figure out, okay, so if I'm not best for this child or adolescent or adult, who might be? How do I help with that? Okay. Grief is mixed emotions such as sadness, anger, guilt, frustration, fear, anxiety, and they all come out all at the same time. So how are you feeling today? I don't know. I'm feeling everything, right? Reality, that's what's happening. Whenever we experience a loss or we anticipate a loss, the process of experiencing the physical, the emotional, the psychological, and the spiritual to the loss of what's happening, what's really going on, what's the reality versus the fantasy, what's making up my world. The teens are especially difficult. It's especially difficult time to deal with them as the loss. They're young people being torn between what we talked about in the development of being independent and dependent, the push me, pull me, and what does that mean? For one of the children who's a senior, a lot of feelings in regard, should I still go to college? Should I still move on with my plans? Because what will happen if I go? And will my siblings be okay? Will my mother be okay? You know, I do a lot in the house, so should I stop my life or should I go? What do you think? What do we say?
I would suggest that teenager talk to their parent and see, does mom feel incapable of doing these things? Because she may be perfectly fine, and the teenager has this disillusion of, I have to help my mom, and she's actually maybe can reassure the teenager, no, I'm going to be okay, and you should, go to college. But I would definitely bring in the parent with that.
Bring in the parent, okay. Laura, what do you think?
I would bring in the family as well, and I would talk to her about why she thinks she needs to stay versus go. What's that really about?
Great. Why? Why would you do that?
Because... Why do you pick on me?
Because you're so good. You're my helper.
No, I'm not your helper. I'm here to learn.
Do you want me to pass? No. Okay.
Because there's something else going on with her if she feels like she needs to stay there. Is she avoiding moving on with herself, or is she avoiding her feelings? What's that about?
Okay. Good. Anything you'd add?
Well, just remember motivation in everything. The goal is not to make things go away and to make it easy. The goal is to heighten and clarify the conflicting elements so that people can be clear about the competing forces. And then it's the process. We heighten the conflicting elements, and they work through the process of what they want to do. There's a tendency for families to want to make everything feel good and feel better and resolved. And again, what we want to do is to make sure that feelings are there and clearly understood. And from that point on, it's a process.
So if really this teen had a plan, had a scholarship, was going to college, then maybe there's a way to make them comfortable with being able to go but still being a part of the family. So what does that look like? Does that mean phone calls? Does it mean coming home on weekends? Does it mean you'll be home on holidays? If there's a problem, can you trust in your family to let you know? What does that look like? So signs of grief in teens. Lack of concentration. Where would we see that a lot? In the schools, absolutely. Shock and numbness. Avoidance and retreat. I can't go to football practice anymore. It's just not okay. Well, is your sibling okay? Are they doing all right at home? Yes. Has your mom arranged to go back to work? Yes. So maybe football would be a good thing for you. Maybe getting some of that exercise. And you're such an important piece to this team that we really would like you to be here. Let's see. Jealousy aimed at those to have what you do not have. You have your dad to go to the dance. I don't. So although it's a father's-daughter's dance, he's dead. Anger. Self-blame. Maybe it was my fault. Maybe if I had been there before Dad picked up the gun, he wouldn't have killed himself. So I had a client that was referred to me at 90 years old. And in working with her anxiety and her depression, we eventually went back to when she was 19. And she was with her father at the time, and she had some brutal abuse stuff back and forth with the mother and the father who were divorced. And so what had happened was she had been at the house, and she left, and he picked up a gun and killed himself. And nobody ever talked about it because death was taboo. So they're not supposed to talk about it. So she endured the abuse from her mom, and she tried to get away to college, and she wound up being very close to a grandfather, which was a really important piece to her world. And at 90, I think it was 90, 92, something like that, I'm working with her going back to this time frame. In really, if we look at the situation, was there anything she could have done? And in the end, she let the blame go. And the nursing home talked about what a different person she was over those 2 years that it took. And how she wasn't anxious anymore. And all of a sudden, we could close the case as much as I adored her. So she's now 96. She's great. Nervousness, irritability, declining grades, loss of interest in activities, wanting to be alone a lot, up in their room all the time by themselves. You think that's a good thing? Probably not, right? And so the other thing is, this is where a lot of different talents and skills come in. Are they a writer? Are they good at art, drawing? Are they into music, into dance, into cheer, into gymnastics? What are they into? And let's talk about some of those things. And I'll pass this around later, or you guys can look at it later. But one of the goals that I had when I first got my degree was, for 5 years, I took a certain amount of money and I bought a lot of resources. And so I can now copy this and keep this in my office for the kids to do. But this is called Fire and Ice in My Veins. And it's a journal for teens to walk through the death. So at this point, that boy, he can't do this. It's way too fresh. But to give you an idea, this is one of the pages. So finish the picture to represent yourself. So they can do it in their own time. They can do it in my office. They can do it at home. If they're worried about somebody looking at their book, we have a special place that we can hang on to it. But this is a really nice journal that you can use. It's by an MSW as well. And then there was a book that came out a long time ago. There it is. For the younger child. And that we copy this a lot for the younger child in the elementary school. But when someone we love dies. And the nice piece about this is that they can write their name on it, and they can have ownership. And that's another really important piece when we're talking about something that they can hold on to. You know, this is a book you can read with your mom and your dad if you want, or we can talk about it. Bless you. Why can't doctors and hospitals stop someone from dying? So it goes through those different things. Sorry about that. So these are two resources that can be very helpful. How are we doing on time? Okay. So we talked about from infants to toddlers and understanding the developmental stage of what's happening with them. We talked about understanding preschoolers and that they see death as reversible. So he was a horse, and now make him into a dad again. We talked about different tragedies that are happening in the world and how kids can see that online or on the news. And so we want to be sensitive to what that looks like. You know, way back when I was a kid, we would watch Sesame Street and things like that. Now we turn on whatever it is, and we're seeing just unbelievable things, including commercials. Think about the exposure that these kids are getting, right? from 5 to 9 or 10 with elementary school. What does it look like with their development? What do we need to be aware of? So on here it says that, they might overgeneralize. So then nobody should ever get into an airplane, right? So there was a crash, so we should never fly. Especially with car accidents. One of the people who I supervised had a lady who was driving the car that crashed and her mother died. She did not. And so all those feelings that have inundated this woman because of the crash and her mother and the guilt and the feelings and what if, what could, would, should kind of thing, right? So be aware of that. Middle school, what's happening with the middle schooler? Think about development, all the things that are happening, physical, social, emotional, all the changes, the hormones, who's in their world, how they're trying to create independence and dependence at the same time. And same with high school, although there's more of a maturity than 6th through 8th grade, usually. They seek out friends and families. Friends are great as long as they're a positive influence. But if I'm numbing my pain with drugs or alcohol or trying to make it go away, then it's not okay. And then honoring the memory. So when we honor somebody's memory, how do we actually do that? How do you think you honor somebody's memory? Talk about them? Great. What else?
Yesterday, my client showed me a slideshow showing me with a special song and images, and then she added in pictures of her cousin.
That's lovely.
It was while she was doing drawing her.
That's great. Absolutely. What else? How many people have ever been to the cemetery, the grave site? How many people take flowers? Lighting a candle. Going to wherever they have their spiritual world, right? And talking to those people. Sending off balloons. Honoring their memory. Tying in something. Some people make birthday cakes for the person that they loved on their birthday, right? Or anniversary. Go ahead.
Does honoring someone's memory, is it the same for people who has lost a family member that they have hated, they love, but they had such a bad relationship? And how do they honor them when there's so many bad memories?
Yeah, that's a doozy, isn't it? So there's so many other factors with that particular case that the death is a critical piece, but so is all that other hatred. And how do we somehow move somebody forward to create a balance in their world so that maybe they can let go some of that? Or at least find something that's comfortable enough to move them forward because they're stuck probably. Right?
It's also just important to let them, process those emotions or just experience those emotions. Because a lot of the time when somebody dies, it becomes this default kind of response from your families and friends that, oh my God, you must miss him so much. He's such an awesome person, and they become these saint-like, type of persons. And maybe you're the only one who is like, wait a minute, no, he did this to me or that to me, and even, you may not even realize, something that has happened or the person has done until after he has died. You may find out something that's difficult, and, working with that piece that often gets overlooked, and they feel so guilty because I'm supposed to, idolize this person now that he's gone and he's no longer here, but they still, have these emotions that... Right,
and those are great suggestions. Absolutely, because we want to honor that for them too. And so where do they sit, I think, is an important piece. But we know that sitting in anger and hatred and having somebody die, I mean, there's a lot of conflict with all those pieces, right? So how do we help someone express that or move on through that? And can they not talk about it? Do they need to maybe do that through their writing or through their drawing or with a different therapist? Or what does that look like? Great. Yeah, go ahead. Go ahead.
I worked with a lady whose husband had died, and it was a wonderful marriage in all respect to her. She was in love with this man. They were married for many years, and so many things can be uncovered when somebody dies, all their secrets, things that they've hidden. So to allow that person to process if it's maybe debt that was hidden and she's stuck paying it off for years, and didn't know about it, and being able to process it and what does that mean, and you thought a relationship is one way, and it really wasn't. It was,
Yeah.
this is the reality of it, and to find the balance, and then to still honor and find peace. And I think it's a process that we can't put a time limit on, and just be there for them. It goes back to that safety that you always bring up, a safe place for them to be able to process it.
Yeah, I think too, like in the case like yours, yes, a person's endured even abuses, but keeping in mind, a lot of times the hatred is love unfulfilled. And you're talking about loss of opportunity. There's a double loss there. The death and the loss that maybe it would fix itself. Maybe the father would admit, and maybe the father would be sorry, and maybe they could fix it. So it's interesting. Whenever there's intense emotions and hostility, you can bet its affection spoiled. So there's going to be tremendous ambivalence in that situation. Whether it's a great relationship where some of the blemishes come out, or a relationship that primarily looks blemished and some of the other stuff comes out. And having people be able to do that. I saw a wake that was phenomenal in that regard, where the first, people weren't sure where it was going to go, but the first thing the guy said when he walked to the microphone is, the guy's name was Bob. Bob sure wasn't any saint. And you could see the tension in the room. Oh my God. And then he told this remarkable story that had people laughing and crying. And he said he wanted to not turn him into a saint. He wanted to honor him by honoring the fact that he was an imperfect person that we all love. And it was one of the most phenomenal things I've ever seen.
Yeah, that's incredible. And it's so much more genuine because it's real, right? So where do we go when we talk about end of life? We talk about funerals, burials, cremation. For some families, having their kids a part of that is a very important piece. For other families, there's a lot of debate and they don't want it. I just had 2 parents that were arguing about this for 3 of the little girls. So they're 4, 6, and almost 8. And the grandmother was dying. She was on hospice. They knew it was going to come. The mom wanted to bring the kids to the funeral, have them be a part of it. The dad didn't want any part of that, and it was constant conflict. What eventually happened, the grandmother did die, and they chose to go together. And when the dad was uncomfortable with the viewing, he took the girls out. Each of the girls had their moments of, sadness and hard times. But overall, in the end, I said, so how did you feel in the end? And he said, it felt like we were a family. How much better could that be? So these are important questions to figure out where you're at and what's going to happen. And the explanations is a really critical piece so that there's some sense of understanding. We talked about the sleeping and the nightmares. God loved Daddy so much that he took him to heaven to live with the angels. Child's response, fear of God, fear of mom, fear of dying, fear of love, rejection, and spirituality. We believe that Daddy is in heaven with God and that God knows how very much we miss and love him. Grandpa went on a long trip and won't be coming back. Why didn't Grandma say goodbye before she left? Doesn't she love me anymore? Talked a little bit about that. Grandma was very sick and the sickness made her die. We believe that she will be with God in heaven. You must always be a good little boy or girl because Daddy is watching you in heaven. Paranoia, fear of making mistakes, extreme guilt, feeling of loss of privacy. Daddy's love for you can never die. He is not with us like he used to be, but we will always remember and love him very much. Then I was going to touch a little bit on divorce and loss. And if you think some about the stages of development, this will walk you through those different things. Divorce is a big loss. Leaving your house in the middle of the night, watching the domestic violence that occurred, the 5 kids who witnessed the father killing the mother and then the father dying, and what they're going through with their ages and stages of being young. I think the youngest is 7, I heard, is that right? All the way to 24, and what actually happened there. And then it goes through Kubler-Ross's stages through the divorce for a child. So children need to feel that they're believed by their parents, that they'll that they'll be okay, that maybe they're not going to get back together, but they want to know that they are, so we need to help with that piece. And they may be angry, and we need to help them say that just because you had your toys out every day and you didn't pick them up doesn't mean that's why mommy left, right? We need to help them with that. Bargaining, helping the child with that, so that they say, one of the things that they said is, if I do all my chores, maybe mommy and you will get back together, right? So that same kind of thing that we talked about, the depression and then the acceptance. I think we're getting down to the wire here. So providing time to grieve, noticing normal behavior versus concerns with, are we moving into a more complicated level, and providing continued counseling support, individual or group, New Song Center and other places too. ASU used to have a program. Defining your defense mechanisms, your coping styles. Are you numbing your pain, and what's happening with that? Are you withdrawing and isolating yourself? What's actually happening? Helping the survivor acknowledge the loss, talking about the loss, visiting the grave site, helping them with their anxiety, their sadness, their decision making. So my husband died a month ago. It's time for me to sell my house. Don't you think I should sell my house? We often say, don't make really big critical decisions for the first year. Give yourself a break. Unless it's survival, right? Then just let yourself be and get the support and try to, move into this new journey of what life's going to be like without him or her. Useful techniques. A lot of times in a grief and loss group, they'll do a goodbye letter. So with that professor I was telling you about, one of the tasks that we had for the semester was to write a goodbye letter to everybody in our lives that was important in one notebook, and to keep it. And it was amazing to walk through what that felt like if you would never see this person again. And what did you want him or her to know about who they were, what your relationship was, what your life was? So writing something like that can be really powerful for yourself and for others. So saying goodbye. Sometimes, at Phoenix Children's, we did, I think I said this, but little cards that were tributes to whoever, and then flew the balloons. So putting it in the balloon, tying it on, role-playing. You as the therapist and the child or the parent or whatever. Helping them with damaging self-talk, negative thinking, moving into positive thinking. Memory books, another important thing. I had a 5th grader who was so afraid of forgetting her brother. She didn't know what to do. I can't hear his voice anymore. I don't know what he looks like anymore. So we just created his world in a book. He was a guitar player. He had all these different things. So she brought a lot of pictures, a lot of things that were important in his life. So she could always look back on that. And she said, it was so good. I started to hear his voice again. So it's a really helpful thing. I had a whole bunch of references, but that one didn't come out. So this is From Birth to Death, A Journey of Life, Grief and Loss, A New Day, A New Beginning. Honoring the memory of a loved one, take a breath and continue on through your journey of life. So what I want to do is pass this out. These are books for children that you can use. Bibliotherapy is a really helpful tool that you can do. Dinosaurs Divorce, Dinosaurs Die. Those are 2 excellent books for the younger child. There's lots on teen and grief. So these are some resources if you want that. Go ahead and take that and pass it around. Questions? Go ahead.
In the stages of life, in the stages of processing and everything, would you briefly touch on maybe a person dealing with relief of a death, if they feel relieved and dealing with the guilt of why am I not as upset because, bittersweet, like they were in a lot of pain or things like that, and so they might feel relieved that the person is dead?
Mm-hmm. Absolutely. So what we didn't get into a lot is different types of death. I'm looking at doing another part 2 presentation that you should know about. I'm sorry?
Did you see the schedule?
No.
I think it's 2 weeks.
Oh, it's 2 weeks.
Dr.
So in
Barton's
2
coming in
weeks.
next week, and then Susie's going to come back and do part 2. Okay.
So I'm going to touch a little bit on violent death, suicide, and the reality of the differences between those. So when we think about somebody who's had a chronic illness such as cancer, and you're watching their deterioration of the body and the mind and their ability to be independent, and it's progressing. a lot of times there's an overwhelming sense of relief because they're not in pain. And it's not that I don't miss them, and it's not that I don't want them, and it's not that me caring for them 24/7, that I would like them again so they'd be with me. It's that they're not suffering anymore, thank goodness. And so I know that they're finally at peace. So I think sometimes there's a little bit of that. I was actually having a discussion, we didn't even realize we were doing it yesterday, with one of the therapists about her particular death that happened with one of the people in her life that was long and carried out. And my particular death that happened with my father, which was he's going to see me at 7:30 and then getting a call. And how, for her, she was just saying she couldn't possibly handle how long it took for this person to suffer. And for me, it was like just another day, right? And so I think that that's the part of honoring. That's the part of not sitting in judgment. That the reality is people can feel the losses at all different levels, and it's okay. It's only not okay when they're no longer safe or healthy, or it's impeding on their child, and we're concerned that we might move in that direction. Help at all? Okay. More questions? Well, you've been a delightful audience. Thank you for participating. I hope you guys have a nice day.